Hi, have a nice lunch. Today we're going to talk about Obamacare declaring war on the doctors of America. All of the worst fears that we've had about Obamacare have come to pass. The Medicare Payments Advisory Commission, MPAC, that is the body created by Obamacare to figure out how to cut $500 billion from Medicare over the next 10 years, has issued a ruling slashing, eviscerating, decimating, decapitating doctors' fees in the United States. What they propose to do is to say that specialists must face a pay cut of 6% a year for each of the next 3 years, and then a freeze, regardless of inflation, for 7 more years. So if you have inflation at about 3%, that comes to a pay cut of about 50% over the course of the 10-year period in real dollars. General practitioners are only slightly better off. They don't have a real nominal cut. They just have a 10-year freeze. So at 30% inflation, 3% a year, that's a 1/3 pay cut. The effect will be catastrophic. First of all, it'll take effect immediately for Medicare only. But Medicaid always follows the Medicare schedules. And then the health insurance companies will probably do the same. And you are really talking about a fundamental change in the healthcare system in the United States, cutting specialists in half in their income and GPs by 1/3. It means that nobody's going to go into medicine. Kids are not going to become doctors. Doctors will retire early. Specialists will opt out of Medicare. So if you're on Medicare, you could see a GP, maybe if you're lucky. There'll be few enough of those, but you can see some of them. More likely a nurse practitioner or a physician's assistant. But if you have cancer, you're not going to see an oncologist. If you have a heart condition, you're not going to see a cardiologist. If you have a gastrointestinal problem, you're not going to see a GI specialist or an OBGYN specialist. Forget about it. They are simply not going to be in the Medicare program. And what's going to happen is that you'll use your Medicare for sort of the basic stuff, but anything more sophisticated, you're going to have to either pay out of pocket or get the same kind of health insurance you had before you were 65 after you're 65, because that'll be the only way to pay it. It'll completely ruin the Medicare system, and it will mean that seeing a doctor is increasingly rare. Most of the medical care will be mass-produced, and the doctor will sort of be the administrator who oversees it. It is absolutely horrific. And this is precisely and exactly what I and a lot of other people warned would take place if Obamacare passes. Now, the actions of this board have the effect of law. They can't be, they don't have to be ratified by Congress. They take effect. Congress, of course, can override them. It can make a new law. This isn't a constitutional amendment, but it's going to take that. So, adjacent to this email where you got it, this video, you'll see a click for a petition. Please click on that petition and sign the petition to ask Congress to overcome and override these cuts in medical fees. And particularly if you know doctors or people in the healthcare industry, forward this to them and ask them to become involved and ask them to spread it virally throughout their communities. The AMA isn't doing it. They're doing nothing to defend doctors anymore. Doctors have to do it for themselves, and this petition might be a very good way of doing it. This is absolutely the most fundamental challenge we've faced to quality medical care in the United States. Thanks for watching, and I'll see you tomorrow for lunch.